I want to talk about biofeedback testing. I've been using biofeedback testing for about 8 years, and biofeedback testing is a great way to get some basic information, and sometimes it's extremely reliable, and sometimes it uncovers things that we wouldn't already know about a patient based upon their history or any of the normal exam findings we have. It's very inexpensive. It doesn't take any time to get the information back from a laboratory, and it doesn't hurt to do it. There's no blood draw or anything like that. So it's really a super efficient way to get some very basic info. The way the device works is that it sends digital signals into your body, and we're going to start with a sensitivity test, and we're going to use one for heavy metals. It'll send signals into your body for mercury and cadmium and lead and arsenic and things like that. And if your body is unhappy with that digital signal, the skin resistance of your hand will change, just as it would if you were taking a lie detector test and you told a lie. And so the machine will read that, and then it'll rate it, and we can tell if things are in range or out of range. And so we'll demo that right now. So put your hand out there, and let's do... So what the machine is doing right now is it's scanning through different biomarkers in this patient's body. Biomarkers are things like acupuncture points, and it's reading 35 of them. And then it's going to run through, after it gets a baseline, it's going to run through a simple test for different things that there might be a sensitivity to. So there's aluminum, antimony, and arsenic, and cadmium, and copper, and lead, and things like that. And then at the end we'll get a little printout, and we can see on the graph that we have some things that are very high here over this red line. If something's over the red line, we can assume there's a sensitivity. It could mean that there are metals inside her body that she's already sensitive to. And then so we got 1, 2, 3 that were out of range: tin, radium, and thallium. Now we're going to run a very quick test on food groups. And so we're going to look at foods that may be causing stress to the patient. So this would be similar to what you might think of as an allergy test, although these things are not necessarily allergies, they represent sensitivity. So I always call it a sensitivities test. So we're scanning to see if there's different kinds of foods that her body is not really happy about, you might say. So we got a result here, and we got a list of foods with negative numbers. And so the higher the negative number, like this food is sweet and low, which is an artificial sweetener. Brown rice, which is a food that we would consider good for us. Most people think that's not so good. This is probably considered good. Yellow squash, black bean, corn, sugar cane, onion, things that are, most of these things are considered good food. Now we got Splenda down here. You should never have Splenda or aspartame. But nonetheless, you can be sensitive to anything. You can be sensitive to things that are good for you as well as things that are bad for you. And sometimes you don't realize that you're eating something over and over again, which is sometimes a cause of becoming sensitive. The more contact you have with something, the more likely it is for your immune system to peg that as an invader. So eating different foods every day is really a good idea in order to prevent sensitivities. Now we can take this information. I could take this printout and I can give it to my patient, and she can look at that and say, okay, I'm going to avoid these things. But the very best thing to do is to actually take that information and then do desensitization, and we'll cover that in a different video.